Hello and welcome to Health, Fitness and Nutrition, the YouTube channel where we explore the amazing wonders of our bodies and how to keep them healthy and strong. In today's video, we're going to dive deep into one of the most complex and fascinating organs in our body, the human brain. The brain is the control center of our nervous system, responsible for processing sensory information, regulating vital functions, and enabling cognition, emotion, memory, and learning. But what is the brain made of? How does it work? And what can we do to protect it from damage and disease? The brain is composed of two main types of cells, neurons and glia. Neurons are the basic units of communication in the brain, transmitting electrical and chemical signals to each other and to other parts of the body. Glia are supporting cells that provide insulation, protection, nutrition, and repair for neurons. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. The cerebrum is the largest part of the brain, divided into two hemispheres that are connected by a bundle of fibers called the corpus callosum. The cerebrum is responsible for higher cognitive functions such as language, reasoning, problem-solving, creativity, and personality. The cerebrum is also divided into four lobes: the frontal lobe, which controls planning, decision-making, and motor skills; the parietal lobe, which processes sensory information such as touch, pain, temperature, and spatial awareness; the temporal lobe, which handles auditory information such as sound, speech, and music; and the occipital lobe, which deals with visual information such as color, shape, and motion. The cerebellum is located at the back of the brain, below the cerebrum. It is involved in coordinating movement, balance, posture, and fine motor skills. It also plays a role in learning and memory. The brainstem is located at the base of the brain, connecting it to the spinal cord. It controls vital functions such as breathing, heart rate, blood pressure, digestion, and sleep. It also relays information between the brain and the rest of the body. The brain, being a vital organ, is well protected by a series of layers and mechanisms that safeguard its delicate structure and ensure its proper functioning. One of the primary protective layers is the meninges, which are a set of three membranes that envelop the brain and spinal cord. The outermost layer of the meninges is called the dura mater, followed by the arachnoid mater, and the innermost layer known as the pia mater. The meninges serve as a physical barrier, shielding the brain from external shocks, impact, and other mechanical forces that could potentially damage its structure. They also provide a supportive framework for blood vessels, nerves, and the cerebrospinal fluid, CSF, system. Cerebrospinal fluid, CSF, is a clear, colorless fluid that surrounds and bathes the brain and spinal cord. It is produced by specialized cells in the ventricles of the brain. CSF performs multiple crucial functions. Firstly, it acts as a cushioning agent, protecting the brain from sudden movements or impacts by absorbing and distributing the forces. This helps to reduce the risk of injury and trauma to the brain tissue. Additionally, CSF serves as a medium for exchanging nutrients and removing waste products between the brain and the blood vessels. It carries essential substances, such as glucose, oxygen, and various ions, from the bloodstream to the brain cells, providing them with the necessary nourishment. Simultaneously, CSF helps eliminate metabolic waste products and other potentially harmful substances from the brain, maintaining a stable internal environment. Another vital protective mechanism for the brain is the blood-brain barrier, BBB. The BBB is a highly selective filter formed by specialized cells lining the blood vessels in the brain. Its primary function is to regulate the passage of substances between the bloodstream and the brain tissue. The blood-brain barrier allows essential nutrients, oxygen, and specific molecules necessary for brain function to enter the brain while preventing the entry of harmful substances, toxins, and pathogens. The selective permeability of the BBB is achieved through the presence of tight junctions between the cells lining the blood vessels. These tight junctions create a barrier that restricts the movement of most substances, including large molecules and potentially harmful compounds, from entering the brain tissue. The blood-brain barrier plays a vital role in maintaining the homeostasis of the brain by protecting it from infections, toxins, and fluctuations in the composition of the blood. The brain is an amazing organ that allows us to think, feel, learn, and interact with our environment. It is also vulnerable to various disorders and injuries that can impair its function and quality of life. Some of these include strokes, tumors, infections, trauma, degenerative diseases such as Alzheimer's and Parkinson's, and mental illnesses such as depression and anxiety. To keep our brains healthy and functioning well, we need to take care of our physical and mental health. Some of the things we can do are: eat a balanced diet. Consuming a diet that is rich in antioxidants, omega-3 fatty acids, vitamins, minerals, and water can provide the necessary nutrients for brain health. Antioxidants help protect the brain from damage caused by free radicals, while omega-3 fatty acids support brain function and development. Exercise regularly. Regular physical exercise has been shown to improve blood flow and oxygen delivery to the brain. This promotes the growth of new neurons and enhances cognitive function. Aim for a combination of aerobic exercise, strength training, and activities that challenge coordination and balance. Get enough sleep. Sleep is crucial for brain health as it allows the brain to rest, repair, and consolidate memories. During sleep, the brain processes information, strengthens neural connections, and removes toxins. Aim for 7 to 9 hours of quality sleep each night. Avoid harmful substances. Smoking, alcohol abuse, and drug use can damage brain cells and impair cognitive function. These substances have a detrimental effect on memory, attention, and overall brain health. It's best to avoid or limit their use. Manage stress levels. Chronic stress can have negative effects on the brain and cognitive function. It is important to find healthy ways to manage stress, such as practicing relaxation techniques, e.g., meditation, deep breathing, or engaging in activities that bring joy and relaxation. Stimulate the brain. Engaging in new and challenging activities can help stimulate the brain and promote neuroplasticity, which is the brain's ability to reorganize and form new neural connections. Learning a new language, acquiring new skills, solving puzzles, or playing strategy games are great ways to keep the brain active and healthy. Socialize and maintain positive relationships. Socializing with others and maintaining positive relationships is beneficial for brain health. It can provide emotional support, reduce stress, and contribute to overall happiness and well-being. Make an effort to spend time with friends, family, and participate in social activities. We hope you enjoyed this video on what the human brain is made of and how it works. If you did, please give it a thumbs up and share it with your friends. And don't forget to subscribe to Health, Fitness and Nutrition for more videos on how to keep your body healthy and strong. Thank you for watching and see you next time. Hello and welcome to Health, Fitness and Nutrition, the channel where we share tips and advice on how to live a healthy and happy life. In today's video, we are going to talk about a very important topic: colon cancer. Colon cancer is one of the most common types of cancer in the world, and it can affect anyone at any age. However, if detected early, colon cancer can be treated and cured. That's why it's crucial to know the signs and symptoms of this disease, and to get screened regularly. In this video, we will tell you the top 10 early warning signs of colon cancer that you should never ignore. Let's get started. 1. Change in bowel habits. One of the most common signs of colon cancer is a change in your normal bowel habits. This can include diarrhea, constipation, or alternating between both. It can also mean having stools that are narrower than usual, or feeling like you can't empty your bowel completely. If you notice any of these changes for more than a few days, you should see your doctor as soon as possible. 2. Blood in stool or rectal bleeding. Another sign of colon cancer is blood in your stool or rectal bleeding. This can be bright red, dark red, or black in color. Sometimes, the blood may not be visible to the naked eye, but it can be detected by a fecal occult blood test, FOBT. Blood in stool or rectal bleeding can also be caused by other conditions, such as hemorrhoids, ulcers, or inflammatory bowel disease, IBD. However, you should never assume that it's nothing serious and always consult your doctor. 3. Abdominal pain or cramps. Abdominal pain or cramps can be a sign of colon cancer, especially if they are persistent or severe. The pain can be caused by the tumor growing in the colon, or by blockage or perforation of the bowel. The pain can also radiate to the back or pelvis. Abdominal pain or cramps can also be due to other causes, such as gas, indigestion, or menstrual cramps. However, if the pain is unusual or lasts longer than usual, you should seek medical attention. 4. Unexplained weight loss. Unexplained weight loss is another sign of colon cancer that you should not ignore. This means losing weight without trying or without any changes in your diet or exercise routine. The weight loss can be caused by the cancer cells using up more energy than normal, or by the loss of appetite or nausea that often accompany colon cancer. Unexplained weight loss can also be a symptom of other diseases, such as diabetes, thyroid problems, or depression. However, if you lose more than 10 pounds without a clear reason, it's important to discuss it with your healthcare provider. 5. Fatigue and weakness. Colon cancer can cause fatigue and weakness due to the body's increased energy demands as it fights the disease. You may feel tired even after getting enough rest and sleep. Fatigue can also be a result of anemia, which is common in colon cancer due to blood loss from the digestive tract. If you experience persistent fatigue and weakness, it's important to get evaluated by a healthcare professional to determine the underlying cause. 6. Changes in appetite. Changes in appetite, such as a sudden loss of appetite or a significant decrease in food intake, can be a warning sign of colon cancer. Tumors in the colon can affect your digestive system, leading to a reduced desire for food. Additionally, some individuals may experience nausea, vomiting, or changes in taste preferences. If you notice a significant change in your appetite or eating habits that lasts for an extended period, it's advisable to seek medical advice. 7. Iron deficiency anemia. Colon cancer can cause chronic bleeding in the gastrointestinal tract, leading to iron deficiency anemia. This type of anemia occurs when your body doesn't have enough iron to produce sufficient red blood cells. Symptoms of iron deficiency anemia include fatigue, weakness, pale skin, shortness of breath, and dizziness. If you experience these symptoms, it's crucial to undergo further evaluation to determine the cause, including the possibility of colon cancer. 8. Persistent abdominal discomfort. Chronic abdominal discomfort, such as cramping, bloating, or gas, can be indicative of colon cancer. The tumor growth or obstruction in the colon can cause these symptoms to persist over time. It's important to note that occasional abdominal discomfort is common and may be caused by factors like diet or indigestion. However, if you have persistent or worsening abdominal discomfort, it's essential to consult a healthcare professional for a proper evaluation. 9. Changes in stool consistency. Pay attention to any changes in the consistency of your stools. If you notice that your stools have become consistently narrower or thinner than usual, pencil-thin stools, it could be a sign of colon cancer. The narrowing of the stool may be caused by a tumor partially blocking the colon, resulting in a change in the passage of stool. While changes in stool consistency can be caused by various factors, it's important to discuss them with your doctor, especially if they persist for an extended period. 10. Family history and personal risk factors. Having a family history of colon cancer or certain personal risk factors can increase your likelihood of developing the disease. If you have a close relative, parent, sibling, or child who has had colon cancer or certain types of polyps, your risk may be higher. Other risk factors include a personal history of inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, a sedentary lifestyle, obesity, smoking, and a diet high in processed foods and low in fiber. If you have any of these risk factors, it's important to discuss them with your healthcare provider and consider appropriate screening options. Remember, The presence of one or more of these warning signs does not necessarily mean you have colon cancer. However, if you experience any of these symptoms persistently or notice a significant change in your bowel habits, it's important to consult a healthcare professional for further evaluation. Early detection and treatment of colon cancer greatly increase the chances of successful outcomes and long-term survival. Thank you for watching this video on the early warning signs of colon cancer. If you found this information helpful, please give this video a thumbs up and consider subscribing to our channel for more valuable content on health, fitness, and nutrition. Take care of your health and be proactive in maintaining a healthy lifestyle. Remember, knowledge is power when it comes to your well-being. Stay tuned for our next video, and until then, stay healthy and stay happy. Hello and welcome to Health, Fitness and Nutrition, the channel where we share tips and tricks to help you live a healthier and happier life. In today's video, we're going to talk about how to purify and detox your lungs naturally. The lungs are vital organs that allow us to breathe and exchange oxygen and carbon dioxide with the blood. They also filter out harmful substances from the air we inhale, such as dust, pollen, smoke, and pollutants. However, over time, these substances can accumulate in the lungs and cause damage, inflammation, and respiratory problems. Fortunately, there are some natural ways to cleanse your lungs and improve their function. Here are some of the methods you can try at home. 1. Steam therapy. Steam therapy is a natural and effective way to treat respiratory problems and purify your lungs. It works by using water vapor to open up the airways and loosen the mucus in the lungs, making it easier to breathe and expel the mucus. Steam therapy can also help to soothe and moisturize the irritated tissues in the lungs, reducing inflammation and promoting healing. One of the easiest ways to do steam therapy is by using a humidifier. A humidifier is a device that adds moisture to the air, which can help to alleviate respiratory problems caused by dry air. You can add some drops of essential oils, such as eucalyptus. Coughing. Controlled